Hi there, I'm Steph Wells, Mike and Steph in the morning on B104, and today I have the pleasure of introducing one of the very talented staff at LVHN. Now, in the past, we've done these segments in person, but we're taking the recommended precautions and doing our segment remotely. Lehigh Valley Health Network is taking every step possible to provide safe care. They're committed to keeping you safe in all of their emergency rooms and hospitals, practices and testing sites. Patients and visitors are screened daily, and colleagues are screened before the start of their shifts. And rooms and equipment are sanitized regularly. And waiting rooms, they've even been rethought to provide social distancing. And of course, we all know it, masks are required. And before we get into today's segment, I want to tell you a little bit more about LVHN Coordinated Health Orthopedics. LVHN Coordinated Health provides the most extensive orthopedic services with the most surgeons and specialties in every type of joint. They offer the orthopedic success rates in the region. Their numerous awards are evidence of that, including the region's only nationally ranked hospital for orthopedics by U.S. News and World Report. And LVHN ranks 35th in the nation for orthopedics, putting them among the nation's top 3% of leading hospitals in this specialty. So without further ado, I'd like to introduce Dr. Jonathan Brown, who is an orthopedic surgeon with LVPG Orthopedics and Sports Medicine. And today it is all about hip pain. Welcome, Dr. Brown.
Thank you very much. It's a pleasure to be here.
So let's start with the very basic. We're going to try to break this down into little bits of information for everyone who's checking us out today. What exactly is hip pain?
So hip pain is miserable. So the best way that I can describe to people when they come in and they're thinking about, is this what's going on and why do I need to be seen by an orthopedic surgeon is, hip pain is extremely debilitating. It's pain that you find in your hip, and your hip is the front of your thigh, into your groin, and into your buttocks, and it's debilitating. Think of all the things you do where you lift your knee up, where you swing your knee and leg out, bending down to putting on your shoes and socks. Those are things that people with hip pain have a tough time doing. People come in and they say, I just hurt, I feel stiff, and I don't know why. And we talk to them, we look at x-rays, we examine them, and helping people understand, what's actually hurting. And it's their hip that's hurting them, gives them a lot of answers and kind of gives us a place to jump off and start the conversation.
Very good. And you might have touched on this a little bit already, but is there one root cause for hip pain, or are there a lot of variables?
There can be a lot of variables. The main reason that most of us on the joint replacement side see people in the office for hip pain is because of osteoarthritis of the hip. So it's wear and tear arthritis. Hip arthritis is very common. The other reason that we often see people, especially younger people with hip pain, is something called osteonecrosis. And that's another type of bone disease that I tend to see a lot of in younger people. And it's a disease where it's somewhat of a rapidly progressive arthritis that comes along from many reasons. The main reason is why there's a disruption of blood supply to your bone. Your bone is a living, breathing thing that has a blood supply. And especially in the hip, when you lose that blood supply, causes death and remodeling of the bone, and can be extremely painful. So those are the two main reasons that we on the joint replacement side see people with hip pain.
You talked about those two groups of potential patients that would be coming to your practice. Right. Anyone else who might be affected or most affected by hip pain?
The hip pain kind of crosses over all ages and all sorts of people. Often on the joint replacement side, we are seeing people who are over the age of 50. That number changes a lot, and there are some younger folks who do have hip pain and reasons for hip pain. Some of the young adults that we see have hip dysplasia, which is actually the hip didn't form correctly, or at the time they were basically they were in their mother's womb, they weren't forming correctly. There's post-traumatic reasons, obviously being a trauma center We see a lot of people with hip fractures and acetabular fractures, which are fractures of the hip socket. So after those types of injuries, we often see people with post-traumatic arthritis or other issues associated with their hip that we end up taking care of and who need joint replacement.
Wow. What are some non-surgical options to treat hip pain?
It's a good question because, often people, if you come in talking about surgery right away, people fall across the spectrum. So the first things that we always talk about is, activity modification. You talk about, what are the things that bother you and what are the things that, you want to do that you can't, and how can we modify ourselves to not have the kind of pain that we're having.
Mm-hmm.
That can be a really touchy subject, though, because a lot of people have very simple wants and desires. All they want to do is be able to walk, to be able to hang out with their kids or their grandkids. They want to exercise again. They want to ride a bike or simple things. And they're not talking about run the marathon. They're talking about being able to walk around the grocery store.
Right.
So when we talk about activity modification, sometimes it's a touchy subject. So there are medications, anti-inflammatory medications, physical therapy, and other exercise things that we suggest to certain people in certain situations. Cortisone shots, well, most people know about cortisone shots in the knee. There are options for cortisone shots in the hip. They're not as common, but we do discuss them, and there are options to get them, and they're office-based procedures, which don't require any time in the hospital. We do them right in the office. So those are the main non-surgical ways that I address hip pain with my patients.
When should a person go to see a doctor about their hip pain?
That's the big reason that a lot of people come to see me, and I think is appropriate, is when they're having hip pain that's interfering with their day-to-day activities. Now, everyone's day-to-day is different. Someone who's trying to work and, trying to do a pretty physical job, their day-to-day is different than someone who's trying to get around their house and go grocery shopping and work in their garden. So the time to come see someone about your hip pain is when your day-to-day life is affected by your hip pain.
What this seems like a biggie to me. What is a total joint replacement? It sounds big. What exactly is that?
And that's the thing. That's the tough part, is because whenever I sit down and talk to people, and I give them the same talk that I just did about what are the options for fixing me, and the last option is always surgery. So total joint replacement, total hip replacement is a replacement of the ball and socket portion of the hip that replaces it with metal and plastic, and allows them to take away your arthritis. I tell people, in general, arthritis and managing arthritis is a Band-Aid. Everything we do is to help your symptoms. We haven't figured out a way to turn back the clock. Your arthritis is a fact of life. So when we get to the point of curing your arthritis with surgery, giving you a hip replacement, we are taking out the parts of your bone and reshaping the parts of the bone that are arthritic and giving you metal and plastic implants that take that away.
Is that a very common procedure? I mean, I don't know if you can break it down to percentage, but
that's
a lot.
Yeah, that's the thing. Everyone wants to know that. Is this, oh my gosh, is this, why me? Why are we doing this? And it is a very common procedure, and hip and knee replacements in general are some of the most common major surgical procedures performed across the world. Here in the Lehigh Valley, we perform thousands of hip replacements a year. It's, across the entire spectrum of orthopedic surgeons, those of us who do joint replacement, specifically hip replacement, all of us are doing hundreds of them a year. So those numbers add up to a huge percentage. And, in terms of return to quality of life, hip replacement is one of the best surgeries in terms of healthcare dollars spent to get us a return on quality of life. The only other thing that tends to rival it is open heart surgery. And how do you put a price on actually saving your life, which is what our open heart surgeons do. So it's a privilege to be able to do joint replacements and to do so many of them. I'm
sure a lot of people have question about safety. How safe is it to do a total joint replacement?
Yeah, there's no way around the fact that major surgery is major surgery, and there's risks to it. Hip replacement is a very safe surgery precisely because we do so many of them. So, the biggest things that we discuss in terms of this, that I discuss with my patients, is that, this is elective surgery. This is a planned thing. This is something that you come and we talk in the office when we get this set up. You've been living with arthritis for some time. This isn't rushing you off to get your appendix taken out. This is, we plan this, we think it through, we make sure you're as optimized as possible. So all the medical reasons, where there could be an issue with your heart or with your lungs, we get those things sorted out first. And then when the time comes to do this, we do the surgery. And the risks inherent with the surgery, they're there, but they're things that we can mitigate by our experience and by our volume.
I thought, now this is me not knowing much about this until I just spoke to you now. I thought, hip replacement, it's one thing, but apparently there are different types. What different types of hip replacement are there?
Well, the big thing that people think about when they start talking about types of hip replacement are, everyone talks about, well, how is my hip replacement going to be done? Am I going to get it done to the front, to the side, to the back, or whatever? And those are things that, as we talk about it, we can dive into that a little deeper. But, there are many approaches. As surgeons, we talk about approaches to a bone or a joint. There's different approaches to a hip replacement, the direct anterior approach, the lateral approach, the posterior approach, or we could list off dozens of names of ways that people get into a hip joint. And that's what people tend to focus on for lots of different reasons. There's lots of reasons why people tend to focus on that. But those are the things that really we touch on in the office.
It's kind of like you knew my next question, because it is, what is an anterior hip replacement?
That's kind of the thing that, when people are that's what people are asking about hip replacement. Some people, for various reasons, people talk about approaches to the hip, and anterior hip replacement is not a new surgery. The anterior approach to the hip has been around since the 1800s, when the French were figuring out how to operate on tuberculosis of the hip, when people got tuberculosis infections. But the use of the anterior hip approach for hip replacement has skyrocketed somewhat in the last decade or two. There's lots of reasons for that. Some of it is, to be quite honest, industry marketing, and some of it is that those of us who've been trained on how to do this, in our training as a younger surgeon and in our fellowships, which are advanced trainings in one specific area. So what I learned how to do, part of what I learned how to do in my training, was I was brought up doing anterior hip replacement. And there's some distinct advantages to that. And one of the main advantages that I find with my patients who get anterior hips is that they tend to be faster recovering slightly. They tend to be faster in recovery and getting away from using a cane or a walker. They tend to progress a little earlier and need less help after surgery. And the thing about that is, it's very rewarding to be able to get people back moving faster with a surgery that's already so good. It's tough because hip replacements are so successful. So any approach to the hip is going to be a good one. And, a well-done hip replacement's a great surgery. But when you can tap into those couple extra percent between 95 and 100, that's a pretty powerful thing.
What you described there was obviously a very big benefit to getting the anterior procedure. Are there any other benefits that you haven't already touched on, getting that versus other surgeries?
That's the thing. It's tough because, I perform a huge number of anterior approach surgeries, and other surgeons in the area do as well. But the big thing that I always impress upon all my patients is that hip replacement's a great surgery. And, well done total hip is going to serve you well. But if we can find some way to make things just a little bit better, to make things move a little faster, to give you just that extra step that gets you ahead of the curve, then there's no reason why we shouldn't tap into that and use all our resources to do so.
What does somebody do to prepare for total joint replacement surgery?
That's another big thing that we spend time talking about in the office, is how do we get you ready for this? The biggest thing that you can do is mentally prepare. A lot of joint replacements and recovery from joint replacements is mental preparation. I tell people that, a lot of what we do as orthopedic surgeons is, I'm there with you. We do the carpentry and we get you set up, but the best thing I can do to get you ready is to tell you how this is going to be and to tell you how we're going to be with you as we get through. You know, you got to mentally prepare for your recovery and for the fact that this is surgery. You know, you're buying into, a couple of weeks to a couple of months of recovery time for years down the road of having a good solid joint replacement that's going to serve you well and give you your life back. So mental preparation is big. The second part is general physical health. You know, we ask that, you take care of yourself. You see your primary doctor. You take control of your own health and your own weights and everything, and be ready for when the time comes. So when you're ready for your joint replacement, those things are off the table as problems. And the third thing that ties into that mental preparation is good attitude as we go through it. Expect us to be professionals and expect us to be there with you and to answer your questions, and don't settle for someone not answering your questions. Get your questions answered, be ready to go, and we'll be able to help you and take good care of you.
You're getting ready for the procedure. You're going into surgery. Who is in the room with you? Who's on that team during the procedure?
Well, the best part of what this is it's a team. It's a team sport. The surgeon is the face of this, and they're the ones. I'm the one with you in the office, and I'm the one who, ultimately you and I decide together that this is right for you. But I wouldn't be able to do it if I did it alone. For most of us, we have 1 to 2 other assistants in the operating room. For us, we usually have physician assistants that are with us. They're there to help get you ready for surgery, to help us with instruments, to help us do our job as perfectly as we can. Along with that, we have the hospital staff, the scrub techs, and the nurses that are in the room with us that pass us instruments and keep us on task. We have the nurse that's there with you in the room, who is the circulating nurse, who's there to keep everything going in the right direction, to handle the administrative stuff and the paperwork, and to handle all that side of it. We have our team from anesthesia, the anesthesiologist and the nurse anesthetists, who are there with you, giving you that minute-to-minute care, keeping you safe. And then that all of us working together allows us to, each of us focusing on our one job and that bigger whole, that gives us the ability to give you a good result.
That's fantastic. What happens after surgery in the hospital?
That's a good question. So most folks go to, after surgery in the recovery room, they're there for a little while as they kind of wake up, and then they go to their room and you get up and walk. Everyone with a joint replacement gets up and moves the day of surgery. You might not set any records, and I tell people that, we're not looking for you to do something crazy, but you can get out of bed. You're going to get out of bed, you're going to walk around your room at least and sit in a chair. You're going to get out, you're going to stand in the hallway, you're going to get up and go to the bathroom. You're a normal person. You're healthy. The reason we're doing this is you're healthy. And we want you to get up and move and be a normal person. Put clothes on. Get out of your hospital gown. I really encourage my patients to do that kind of stuff, because that's the mental side of recovery, that you are ready to be a person again, and you're not sick. You're not in the hospital because you have some issue that needs to keep you there. We needed a place to do the surgery, and the safest place for you was the hospital. So there we are. And you start doing your therapy day 0. As soon as you get your hip replacement, you're doing something physical therapy that day. And those are the big things that happen early on. And hopefully most people are only in the hospital some, one night. Some of my hip replacements, especially my anterior hips, leave the same day. I always kind of put that on the table for people who are moving and motivated. They can get out the same day, especially if surgery was in the morning. Most folks are there one night. They're home the next afternoon. Some people stay 2 nights. It just depends. Our goal is your safety and your success.
Okay, so you're saying the average stay would be 1 day, maybe 2.
Yeah, maybe 2.
Is there ever any chances that might be a longer stay, or is that very rare?
It's very rare, and it depends on each individual patient. Sometimes there are reasons why you can't go directly home, why you need to be in a rehab facility of some kind. But most folks feel pretty darn good after they get their hip replaced and they get up, they move. Like I said, some folks go home the same day because there's no reason for them to be in the hospital. They don't need the level of care the hospital provides. A lot of folks stay one night, they get up, do their therapy the next morning, and they're ready to go after lunch.
What happens once you're discharged? Like now the next day you're at home, so on and so forth. What happens after then?
For most of the hip replacement patients, we tell you to get back to doing your normal life and move around your house, get up, walk, go to the bathroom, go to the kitchen, make your lunch, do what you want to do. You're not going to have a lot of endurance right away, maybe, so take it easy, for the first week or two. People start doing home exercise immediately. We send them home with things to do and exercises. And the other side of it is a lot of people begin their therapy pretty quick. Some folks have therapists come to their house. A lot of folks now are able to transition right away to going to physical therapy and doing outpatient physical therapy. And that's a huge win. You just get more benefit out of getting out of your house and getting to the therapist's office, getting to the therapy gym and getting moving than sitting around in your house and just waiting,
Right.
But there's a lot that happens with the hip replacement that's just live your normal life. There's not a whole lot that's required to have a great result. We ask you to get up and move. We ask you to take care of yourself and take your medicines, and that's about it. We try and keep this as streamlined as possible, because the less you're thinking about all the stuff you should be doing or need to be doing, and the more that you're just living your life, the better.
Is it fair to ask the question if there's an average recovery time, like, days, weeks, months? Is that a fair question to ask?
That's a fair question. It is different for every person. And because these are the questions this is what people ask me, what can I expect? And recovery is on a spectrum, and it all depends on what your goals are afterwards. But, I tell people that for the first couple of weeks, you'll be taking it easy. You're up, you're walking, you're putting full weight down. And I see my patients back early, the first visit back at 3 to 4 weeks. At that point, most people are walking in the office. They might be carrying their cane with them. Some folks walk in with nothing, and you kind of just take a double take and be like, you actually had your surgery, right?
Right.
And that's when people start to feel normal again. Then by 6 to 8 weeks, people are back doing a lot of their day-to-day. And by 3 months, we noticed that most of the hip replacement patients, especially the patients with the anterior hips, are back to living a pretty normal life. People are back to work, functioning, doing their normal day-to-day. And by a year, there's a lot of folks who come in and they don't even think that they had their hip replaced. And that's the biggest joy, is when people forget their hip.
Right.
We look for that forgotten hip. And that's it's a huge thing. And there's so much joy for both of us, patients and myself, when you come in a year and say, I don't even realize I have my hip done. And that's such a good thing.
We only have a few minutes left, so I want to get to a couple big questions for you. For instance, do most insurances cover total joint replacement surgery?
That's a good question. A lot of people worry about that. And the answer is yes. These are surgeries that have been around for a long time. They have a high success rate. This is not some experimental crazy thing. This is something that, we work with you, we document. We do this for you because you're ready to have it done. And the insurances do understand that. And they approve them because they know the benefit that they give.
What should I look for when selecting an orthopedic specialist for hip pain?
So the biggest things I think that people should know about finding an orthopedic surgeon, especially someone for hip pain or joint replacement, is experience and volume. There's a big difference for people doing hip replacements, especially, the number that you do, like anything else, the more you do it, the better you are. And in addition to that is that we mentioned briefly earlier the idea of fellowship training, that you spent an extra year honing your craft. Everyone comes out of orthopedic residency having an idea about how to do, hip replacement, but those of us who take that extra time and focus on doing that, I tell patients all the time, my partners, you want to go see my partners if you have, hand pain or wrist pain or shoulder pain. Just because I can doesn't mean I should. But all I do is hip and knee replacements, and all of those who do that in our group do hip and knee replacement. That's what we do, and we limit our practices to that because we can provide the best care doing that. So volume, experience, training, those are all things that people should look for.
Fantastic. And why should I choose LVHN Coordinated Health for orthopedic care?
So as we talked about, you want to find people who do a lot, and that's us. You want to find people who are experienced, and that's us. People who are recognized for doing what we do, and that is orthopedics, hip and knee replacement. We do them, and we do a lot of them. We do the most of them. So that's why seeking us out is so important. because we're the ones who can take care of you. We can solve those problems with you. We can walk through them. And if there's issues that arise, we're the ones who are experienced enough to handle those issues.
How long does it typically take to get an appointment, and are there virtual options? I know a lot of places are now offering that.
Right, everyone's concerned about that, especially right now, because of all that's been going on. These are somewhat strange times we've been living in. So for us, there are options that within the same day, within 24 hours, you can be seen by someone in the orthopedic groups that we have, and they can get you in the pipeline to get your needs met. And yes, there are virtual options. A big percentage of what we still do every day is, even though we're back in the office, there's time in everyone's day to do these virtual visits and find time in your schedule to see us, and we can find time in our schedule to see you. There's something for us all.
That's fantastic. Once again, we've been talking to Dr. Jonathan Brown, orthopedic surgeon with LVPG Orthopedics and Sports Medicine. And thank you so much for your time, your knowledge, your information. And you have a little bit of information to share with us. How can people find out more?
Well, the big thing, to make an appointment with us, call 888-402-LVHN or visit lvhn.org/joint pain. Thank you very much for allowing us to get together and talk about this. There's nothing that I love better than talking about hip pain and hip replacements, and it's my favorite thing to do. So spending time talking with you has been great.
Very good. Thank you, Dr. Brown, and thank you once again. And we will see you next time. I'm Stephanie Wells, Mike and Steph in the morning on B104, and we'll meet another wonderful doctor from LVHN. Thank you.
Thank you.